Allergy is an abnormal immune response to something in the environment, something that you eat, something that you breathe in, something that you touch. And the body thinks that whatever that is, tree, grass, is the enemy. And so it has an overabundant immune reaction to that allergen. And so what we do at ENT and allergy centers is we look at allergies as an underlying condition for many of the ENT disorders that we treat. Sinusitis, ear infections, nasal congestion, postnasal drainage. All of those things can be affected by allergies. So when we talk about allergy testing, we're talking about how can we best help our patient by understanding what they're allergic to. Allergy testing is done at all of our offices. We have a wonderful group of allergy nurses that specialize in allergy testing and treatment. The allergy test is done at a visit specific for allergy testing. We do the allergy test at first on the forearm. That's a test where we apply the allergen, which is basically part of the grass, part of the tree, the part that we're allergic to, onto the arm. And it's called a prick test because basically we make a little scratch on the arm. And we see if the patient reacts to that allergen. And if they do, we say, you're allergic to this. And an older patient, an adult, will go on to test that further with an upper arm allergy test. It's called an intradermal test. And that tells us not just if the patient is allergic, but how allergic they are. What's great about that test process is that we do a lot of education during the test. So if somebody is allergic to, say, dust mite, we're going to talk to the patient about where you can find a dust mite. It's found in the bedroom, it's found in linens. How can you minimize your exposure to that allergen? Just simple things that you can do around the house. And then we're also going to be talking to the patient about treatments. So that would be medical treatments such as over-the-counter antihistamines, nasal sprays, as well as immunotherapy, which is a treatment where we give the patient what they're allergic to in very small doses. And what that does is it helps the body not see a grass or a tree allergen as the enemy. It's a wonderful way to treat patients with immunotherapy because it's a natural treatment. It's not a medicine. It's not something that is full of all kinds of different products. It's just the protein they're allergic to given to them so that their immune system will no longer see it as the enemy. We have a lot of happy patients with immunotherapy because we're treating the underlying cause of the problem. So we'll have patients that have come in, they've had multiple sinus surgeries, they've had multiple ear tubes, perhaps their quality of life has really been affected by allergies. And when we can treat them with immunotherapy, which I love as a parent because it is a natural treatment, and we see the improvement, we see that the patients don't need surgeries anymore, and we see that they're not using medications anymore. That is such a great feeling because we've really gotten to the core of their problem and been able to help them.